What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even liked it, subscribed. I appreciate you and welcome back. So today I want to talk to you about things I wish I had known or things I wish someone had told me, and I want to continue on that path. But we're not going to talk about after the radical prostatectomy. The thing I want to talk to you about is that prior to being diagnosed with prostate cancer, one of the things that kept happening to me was that I had what amounted to chronic prostatitis. And this is for all of you who have not been diagnosed. Maybe you have an enlarged prostate like I did. Maybe you have just some prostate issues. Maybe you are noticing that you're peeing, or maybe it's being interrupted. And so I wish somebody had told me, because I went to doctor after doctor and it kept going back and forth, right? So I would go to primary care physician. This is why I always fuss about primary care physicians and urologists, because I went to a couple of different primary care physicians, and they kept telling me, one told me that I had a UTI, and then the other one told me that I had prostatitis. And the other one that told me I had prostatitis got to the point where they called in multiple prescriptions of antibiotics just so I could go get them when my back started hurting and I started to feel funny. He would send me and I would go to the doctor. I would go to the pharmacist and I would get the pills and go through, and I would go through the course of the treatment and feel better. But I wish someone had told me how difficult it is medically for a man to get a UTI, right? I had my wife looking at me all crazy like, hey, what the heck is going on with you down there where you keep having these infections? I had no idea. I wish somebody had told me this is an indicator of potential prostate cancer. And guess what? I had prostate cancer. So when you are going to the doctor, if this is a chronic issue for you, if it is something that you are continuously going through with UTIs or prostatitis, right? If they have went ahead and did all that they had to do and kind of said, oh, no, it's not anything that's STD or STI or whatever, then you need to start talking to them potentially about having some additional tests for prostate cancer. Don't get caught behind, guys. I was 3 + 4 = 7, and I got to the point where I was right in the middle. But when all of this stuff was going on is when my prostate cancer was growing. And I just didn't have any idea. I thought that something else was going on down there, and it turns out that it was prostate cancer growing the whole time. I may or may not have had prostatitis. Not sure. I did have an enlarged prostate, but I didn't have a UTI. And at least as far as bacteria and all the rest of that stuff is concerned. But, because of the symptoms and everything else, they were like, well, take this antibiotic. And it started to work some. But the thing was, that wasn't the issue. And so the prostate cancer was driving it, and that's why it kept coming back. So be mindful. If it's you, if it's a friend, if it's a family member, or your dad, or your husband, make sure that if you start to notice that they're having that prostatitis issue, that they are getting checked. And remember, but for the fact that I had my MRI, they would not have caught my prostate cancer, because the digital exam and my PSA, even though it was a little elevated, did not catch my prostate cancer. It's only because I went in for an MRI and later a PET scan and the rest of that. And so, talk to them, talk to urologists, ask them to get you in for an MRI to make sure that it's not a bigger issue, because it's chronic. Hope this finds you well. Hope you find this helpful. Hopefully this saves somebody so that they catch whatever is going on with them, if it's potentially prostate cancer, a little earlier in the circumstance. All right? We're all talking about better outcomes. Hope this finds you well. Peace and blessings, fellas.